Can you tell me what you do and where you work?
I'm a licensed clinical social worker at Rady Children's Hospital Outpatient Psychiatry, and I work with a wide range of mental health issues, including eating disorders such as anorexia, bulimia, and ARFID.
Okay, what's the most challenging slash rewarding part of your job?
I think the most challenging part is when my patients aren't doing well, and when we don't have parent involvement or parent cooperation. That could be the most challenging thing. And the most rewarding thing is when I see a patient go from being very ill and not doing well to flourishing and doing well across all their life domains.
Okay, and then you said that you work with patients that are bulimic or anorexic. Do you ever give them nutrition advice?
I always refer to the nutritionist or registered dietitian at the hospital. However, I am in charge of monitoring their weight, and so we do talk about how frequently they should be eating, what foods they should be eating to make sure that they're putting on weight or refraining from binge eating. So I do guide them in some ways on nutrition.
Okay. Then how does working with underweight or the bulimic clients affect your work?
I think it's a little bit challenging because I'm not a medical doctor, so a lot of times it can be tricky because I have to coordinate with a lot of different people, the registered dietitian, the medical doctor, and sometimes a psychiatrist, to make sure that we're all on the same page and we're all giving the patient the same information on the treatment plan.
And then how does the nutrition of the clients affect your work? How does them being anorexic, does it make it harder for you to do your job or anything like that?
It definitely does, because if they're underweight, then their mental health is also affected. They're medically ill. They're not able to think logically. So until they're back to their goal weight or their ideal weight, then it's really difficult to treat the mental health disorder that's underlying, which is usually like anxiety or depression.
Okay, and then how often do you work with registered dietitians or like physical therapists or other nutrition or medical related?
All the time.
All the time?
Yeah. Mm-hmm.
And then do you want to say anything else about your job?
No, I think that gets the gist of it.
Okay, thank you.
Uh-huh.